necessarily be related to exercise, but it should be in the morning. Um, Also, a lot of supplements are much better off taken with food because otherwise they can upset the stomach. So those are the two simple rules. Okay, so calcium for osteoporosis we're going to cover. There'll be a whole conversation about that. It's actually a lot more complicated question than people realize. There's a good amount, no sound. Is that true? Can you guys hear me? Okay, Rona, you have a problem with your sound, so. Okay, yeah, so no, 1200 milligrams, almost no one should be taking. Actually, no one should be taking 1200 milligrams. It's very difficult to do so. The reason for that is because you're going to have to take that amount of calcium 3 times a day. You cannot take 1200 milligrams once or twice a day. It's not optimal. It's going to increase risk of heart disease. We're going to talk about this in a second, but it's a great question. So it's good that you guys are raising this question. So if you're taking 1200, you need to stop. This would be concerning. There's a clear sign of damage and risk associated with this dose, unless you're taking it 400 milligrams 3 times a day, which would be kind of challenging to do for most people. The only people who are okay taking 1200 if you have such a severe osteoporosis that there's a really serious risk. That should be guided by a professional, by an endocrinologist or an expert in osteoporosis. But randomly, people should not be taking this much. In fact, most of my patients, those of you who are my patient, know that I recommend only 800 milligrams, divided in 2 doses of 400 milligrams each. Yeah, sure. Taking it with any food, yogurt would be a great choice to mix calcium with. Dairies generally have good amount of calcium to begin with, so adding calcium into the food that's naturally rich in particular nutrient is a very smart idea, right? You're just kind of fortifying, if you will, particular food, enhancing amount of nutrient in that specific meal. Okay. All right. Well, that sounds like I think it's fine if I just start doing the talk, and what will happen is we will just go through that. And thank you everybody for congratulations. I appreciate it very much. I'm not yet promoted. I'm official first day of promotion is July 1st. A couple more weeks being an associate professor. Okay, so I'm gonna share my screen and then we'll go from there. Okay, let's do it this way. I think I'll just share the slides. Tell me if you're seeing my slides.
Yes, we do.
Great.
Misha,
Yeah.
I see that Carolyn has a
Mhm.
question. Hand is raised.
Okay, let's unmute her. Caroline, go ahead and ask. Caroline, you have to unmute yourself. I ask you to get unmuted if you want. Maybe it was just by accident. Um, it's okay. We can come back to Caroline. Okay, so we're going to talk about basic approaches. Now, this is all full disclaimer. A lot of this is from my book on integrative geriatrics. So there's a whole chapter on this approach. So we're going to talk a little bit about the diet, exercise, supplements, and then, of course, hormones are going to be a big part of it. We can talk about strontium. Strontium is a little tricky one. In Europe, strontium was standard of care until around 10 years ago when strontium ranelate, which is a drug available in Europe, is not available in US, has been basically removed from most of the treatments due to the increased risk of heart attacks and strokes. And this is the same issue with calcium. So I will talk about strontium in the last couple of minutes because that's also when I'm going to discuss the reason why I'm concerned about excessive calcium, similarly to strontium. Some of you may be taking strontium already that I recommend. It's not the same strontium that was causing heart attacks and strokes in Europe. It's a strontium, organic form of strontium at much lower dose. So it's not comparable. Strontium isn't actually just like calcium, zinc, etc. It's a mineral. It's a mineral that comes in small amounts with food. Okay, so there's a lot of supplements. This is a kind of a relatively full list of things that I recommend. You can see the doses on it. Important point is I almost never recommend people to take those nutrients individually. It's not only too expensive and complicated, It just doesn't make any sense. You can easily find the products that will combine all of the above, all of them here. And particularly, well, except for omega-3s and soya as the flavones, this last two. But all the minerals and core nutrients for the bones should really be combined into a particular product. Once I finish the talk, I'll tell you sort of some of the products that I prefer. We can even open the Fullscript or something like this, and I can show you why. We can take a look at various different products if there's an interest in that. There are a few things here that are actually not listed. Collagen and creatine are believed to be supportive for the bones. The reason they're not listed here is because we're looking at the particularly highly evidenced nutrients first. And then when we get to the end of the talk, by all means, we can discuss other things that people have looked at and things that have less evidence compared to the things that are published in the textbook. So this is from, again, this is from my textbook on integrative geriatrics, which is a text for professionals. But again, you can obtain the book if you want very detailed oriented treatments. Okay, so a couple of things that are critical. Before you think about treating osteoporosis with nutrients, with movement, with food, etc., you have to first ask yourself a key question. What can be contributing to me getting the weakness in the bones? And there's a whole list of things. And on this list, proton pump inhibitors is probably one of the heaviest risk factors. Prolonged intake of PPIs have been very strongly associated with a substantial increased risk in osteoporosis and fracture. It is multifactorial. It's not only blocking of magnesium, B12, and calcium partially, but more importantly, it's also because there's this profound changes in microbiome which modify immune system and increase risk of inflammatory responses. So that is one of the big reasons with PPI. Now, we're actually going to skip this because we kind of covered that, and we could talk about this only if you guys interested. But in short, you can find this protocol in the book, but also, again, we can cover this if needed. I'm I'm sorry. I'm going to let me just change the position since I'm not alone in this house. So the other thing I want to talk about before we talk about supplements is the inflammation. So one of the biggest risk factor for osteoporosis, which is almost never addressed in a standard of care, is inflammation. Turns out that it's probably number one risk factor in terms of frequency. People not realizing how severely inflammation contributes to the bone loss. There's various reasons why that happens. I think you don't need to fully understand the mechanism of that, but the reality is unaddressed inflammation almost always will lead to the bone loss. And there's no easy way to treat that directly without addressing inflammatory response. So whether your inflammation is from mold toxicity, from autoimmune condition, from whatever the cause is, it needs to be addressed. I will say it's going to be very difficult to manage bone loss without addressing inflammation if it's present. Okay. So that's a big risk factor. Of course, for women, postmenopausal state with drop of hormones, particularly estrogens, also represents a substantial risk. So that's another big factor. And believe it or not, there's another risk factor that often under discussed, and that is a very light frame. So people who are very thin are at much higher risk of bone loss for one simple reason. There is less mass on the system, on the bones, literally. So you're carrying around less weight. So people who are very light framed need to do more weight-bearing exercise to maintain the bone mass. And so there's one little benefit from people who are heavier set. You tend to need to do less work for the bones in that sense. So those are some of the core factors. So now let's switch to the specific supplements. So notice, by the way, here anti-inflammatory support is listed as a whole separate section because it's that important. So the minerals, people often forget when they go and think about when they go to a doctor and talk about osteoporosis, it's always calcium, calcium, calcium. That's completely wrong. Calcium alone will never treat osteoporosis. It's grossly insufficient. It should not be done. Right? So you can never take calcium in isolation. It has to be taken with other minerals. Why? Well, because the bone mineralization, yes, calcium is a main mineral, but calcium alone will be insufficient. You have to have all these nutrients in there for appropriate bone formation. If they're lacking in the diet or if they're insufficient, you're not going to create appropriate bone um, turnover. So, meaning appropriate bone turnover is when the bone are replaced at the same amount of time that they're lost, right? Because there's a constant rebuilding. So there's a loss and replacement. So if you starting to lose bone, that means that you're losing more than you're replacing. And it's often related to the lack of particular minerals. So that's important. Now, K2. Turns out K2 is critically important. K2 and vitamin D are considered they're not necessarily, they're completely not the same, but they do have a similarity in how they impact the structure. They even can use the same receptors in certain scenarios. Turns out that we always talk about vitamin D, but turns out K2 is a lot more important than D for the bone formation, for the de novo, from the new bone formation. So lack of K2 thought to be one of the critical factors of osteoporosis. And K2 is not K1. It's really important. K1 we get from vegetables. Most people don't need to worry about obtaining sufficient amount of K1. Back in the day, even 5 years ago, before the new anticoagulants, when people were on a lot of warfarin and Coumadin, it's the same medication. We had to worry about giving people K1. Nowadays, very few people taking that old medication, so we don't really have to worry about that. K2 is a different nutrient. K2 has to be obtained as a supplement. It's one of the very few products that you cannot obtain in sufficient quantities in food. It's almost impossible. Healthy history of K2 has been related to our gut microbiome. So hundreds of years ago, we didn't have any problem with K2 because most of us were not seeing antibiotics. We had a normal microbiomes. Not anymore, right? So there are no more healthy microbiome in adults in this country. And because of that, you can't rely on K2 being synthesized in your body. You have to take it. And that is why K2 is an absolutely essential nutrient. In fact, anybody over 50 should be taking it. Most of the multivitamins I recommend will have an adequate amount of K2. Most of the time, we're going to be talking about MK7. I'm not going to describe the difference between MK4 and MK7. MK4 is a slightly older form that typically comes in milligrams. MK7 comes in micrograms. And typically, good dose of MK7 will be somewhere between maybe 100 to 200 milligrams. But even if you get 50 micrograms, you're probably going to be close to sufficient amount. People who already have osteoporosis, I aim at higher doses, at least at the 100, often 2 or even 300. Vitamin D, I think probably you guys fully understand. You need to have a reasonably adequate level, maintain it there. Soy extracts are really interesting. So this is called isoflavones. There's a really solid data. Interestingly, the countries that eat a lot of soy food, particularly Asia, let's say China, have a substantially lower risk of osteoporosis. And soy isoflavones have been studied in controlled trials showing quite a substantial benefit. You can totally eat soy foods. So if you're eating soy foods on a regular basis, 2, 3 times a week, you're probably going to get enough. Miso soup, tofu, tempeh, all of those foods will have a good amount. If you don't like soy foods, if you have allergies, or if you're just not going to eat them for whatever reason, you can get soy isoflavones extracts, and I do recommend them quite often. Okay, so let me show you a case. This is my own patient quite a while ago, but you can see that, we can quite easily improve the bone structure. So this patient came to me in 2014, and, there was a significant improvement just by adding one nutrient, right? So often, people don't realize how effective these natural approaches can be. They can be dramatically more effective than medications. I routinely would see improvement in the bone structure in 10% or even more, which is very difficult to obtain with medications. Why that happens? Drivers. If I can identify the driver for a particular person's bone loss and I can reverse it, impact is going to be dramatically better than the medications. We actually not going to talk a lot about medications. It's a whole separate presentation. Suffice to say that they all have benefits and side effects, and they have to be sort of carefully judged. I almost never start with medications unless the patient, let's say, if the patient like this would come and their numbers would be closer to -4 in T-score. Sometimes at that severity, I will just immediately initiate both kind of a minerals, more natural approaches in combination with medication because I would judge the risk for spontaneous fractures to be very high. So that would be my way of calling whether or not to invoke the medication sooner. And then last point before I talk just freely about this is the vibration plate. So I'm a huge fan. I don't, I know that a lot of the other experts in this topic do not include vibration plates, and I think it's misjudged. There's been a lot of mixed studies. And I think the problem with vibration plates, which people don't realize, is that there are a variety of different products. So what you're looking here is the product that we recommend. If anybody is interested, I can give you a link. And in fact, you can actually go to our clinic, to GW CIM, if you're interested. We have a vibration plate in the waiting room. You can just test it, see if you like it, and you don't have to pay for it. You can just test it. Um, so this is a high frequency vibration plate. The vibration plate for it to work needs to have at least 25 hertz frequency. I actually like 35 to 50. This is a 45 hertz vibration plate that can be easily set up at that level. Yes, this one is a little more sophisticated because it has this bar that the person can hold on to. But you can also get the vibration plate that simply stands next to the wall without this additional attachment that's going to be cheaper. If you go on Amazon or wherever you buy your items from, you will literally see hundreds, if not thousands, of choices. Never buy the vibration plates from Amazon for two reasons. Number one, a lot of them are actually incorrectly stating their frequency. So they will say that they reach 30 and they will not even reach 15. So there's a lot of products sold that they're not fake, they're simply inconsistent with what they're advertising. The other thing is there's just a lot of plates out there that are low frequency. Low frequency will do absolutely nothing. You're way better off doing Qigong shaking or just literally standing there and shaking, which is what we're going to do today. I'll just show you how you can do a shaking if you don't want to get the vibration plate. And I'm also going to show you a little bit of a movement, other types of movement that we can discuss while we're doing the practice. We'll talk about other types of movement that are very good for bones. So with that, let me stop the sharing. And I know there's a lot of other little pieces here that have not been addressed. So let me start with few. Calcium dose. So why 1200 milligrams of calcium is very problematic? Because it's very difficult to take it in broken doses. So most likely, Patricia, if you're taking 600 milligrams twice a day, that has clearly been shown to increase risk of heart disease, heart attacks and strokes. There's been data on that. For that exact reason, no one should ever take more than 400 milligrams of calcium in any one setting. Now, how do you know if your personal risk is going to be higher? Well, you don't, because it's only some people who will have the higher risk of heart disease from excessive calcium. And it's very difficult to figure out who will and who will not. We don't fully understand this. Studies are obviously done in large cohorts in randomized fashion. And in that, you have to decide whether your particular situation can be applied using the data from the study. That's a very difficult translation to do. So I'm giving you this as a general statement. I recommend for people never to take more than 400 milligrams in one setting. So if you're taking 800, and again, if interested, I will show you the products I recommend. I just break them up. So if it's 800 milligrams, you take 400 twice a day. So you take some with breakfast and then first meal of the day and then with the last meal of the day. That would be the most natural. Now, if you're trying to get 1200 milligrams with food, be my guest. There is zero data to say that that will increase risk of heart disease. The difference is very simple. When we obtain calcium from food, it never comes in the same form that you get it from supplements. Calcium from food always comes in what's called a chelated forms. It's a natural organic form Typically, let's say you're going to eat sardines with bones, which would be the highest concentration of calcium. If you eat the full can of sardines, you're at least getting 1,000 milligrams of calcium typically. It's very easy to not worry about that because it's a chelated form. Chelated form processed very differently than inorganic form. There are some better sources of calcium on the market. Unfortunately, there are very few chelated forms. I don't understand why. I'm presuming it's the cost of making them. So most of the calcium supplements people are buying, they're citrate or some kind of a cheap form that is inorganic, and that is the one that is linked to the heart disease particularly. Because in the trials, when they were looking at it, they were not looking at the dietary sources alone. They were looking specifically at supplemental form from supplements, from vitamins. So that's calcium. Now, let me talk a little bit about strontium. So, strontium has a very strong record of high benefit, higher benefit than calcium. In fact, for a long time in Europe, strontium renylate was a first line of treatment before bisphosphonates. Why? Because of the cost. It's inexpensive and very low side effect profile and very high efficacy. Unfortunately, later studies have started to demonstrate the risk of heart disease. So what do we do with strontium now? Well, we don't prescribe renylate, strontium renylate in this country. It doesn't exist. We prescribe an organic form. Organic forms of strontium can be obtained from any manufacturer. There are many of them, and typically I don't go above 600 milligrams. In Europe, the doses were up about 2 grams on average. So this is the dose at which the harm was demonstrated. At 600 milligrams of organic forms of strontium, we haven't seen this data at all. Yet, if the person is at a very high risk for heart disease, I will not put them on a strontium typically. I will put people on a strontium who we struggle to improve their bones with other means, so there would be an additional add-on later, and it would be at the lower dose. And obviously, I would need to be presumably worried about this person's heart disease. If they have it, then I probably would be more careful. So that's regarding the strontium. Now, there are a number of things I didn't discuss in detail, right? So I did not discuss hormones. And I would not, because that's a whole separate conversation. How do you manage estrogen levels, for example, for bone loss? Generally, this would be required very advanced personalization. You would need to optimize entire hormonal milieu with a provider. It is very effective. It is incorrect to say that somebody should start bisphosphonates before doing estrogens if you're a woman, because the data is actually favors estrogens. Now, of course, if you're at the very high risk for breast cancer or there are other contraindications, well, yeah, so you may not choose to go on an estrogens, but generally estrogens would be my top choice as a first drug of choice rather than bisphosphonates, if indeed is appropriate. So, if there's an interest in a community, we can come back and talk about medications. I don't like necessarily talking about them. All of them have issues. Those of you who've been following and working with me for a long time know that I tend to prefer that I basically like bisphosphonates a lot less than the newer medications. Prolia is, for example, much higher on my list of go to first rather than bisphosphonates because of the lower risk of side effects. And unfortunately, each drug has a problem. For example, Prolia is a forever. You start and you cannot stop. The moment you stop, you're going to lose all the benefit within a year or two of Prolia. So there is issues with each drug, but Prolia does not seem to cause this unusual weird fractures that bisphosphonates do. So bisphosphonates redistributes bone deposition, and people sometimes have very atypical fractures, like the fracture of a jaw, for example. And also, there's also issues with dental work with bisphosphonates. So bisphosphonates carry a lot of certain specific risks that will have to be discussed with your provider. So, all right, with that, I'm at exactly 2:30, which is what I was planning on. That's good. So let's do a little bit of a Q&A for maybe up to 10 minutes, and then we'll transition to the mindfulness. Well, actually, it'll be more of a movement rather than mindfulness. Okay, all right. What are the proven methods time for sleep gum if there's no effect? Um, so James, we'll have to wait for this. This is a personal question, so we'll have to wait to discuss this after the meeting because this is not general question for general public. There's no point in me answering this because each gummy is different. There's hundreds, if not thousands, of various gummies. Some have CBD, some don't. Each gummy will have a different application for a different person. Yes, so you can totally use the plates with joint replacements. There's zero problems. Obviously, you wouldn't want to use it immediately after joint replacement. You have to wait until your joint fully healed, meaning you have to get an approval from your um, orthopedic surgeon that you okay to exercise completely at that point. So usually that happens very quickly. Nowadays, joint replacements, people ask to be exercising fully just within a few weeks. So definitely 3 months out, it should be pretty safe. Okay. Okay, so let's just do this. Since Jessica is asking about specific bone products, I'm going to show you some of my favorite products. I presume people would be interested in this since there's actually more than one of you is asking. So it's 3 questions. So let's do that. I'm going to, again, share my screen, but this time I'm going to share a full screen. And what I'm going to do is I'm going to just go to the Fullscript. And that is not the right slide. That's weird. Okay, how do I do this? I'm gonna stop sharing for a second. I need to bring my. Okay, just 1 second. I'm trying to get my Chrome, and for some reason it's not opening. Oh, okay, weird. Okay, okay. Hmm. Okay, I'm gonna close the Chrome and reopen it because I'm having problems for some reason. Okay, cancel. All right, let's try it again. Hmm. This is funny. Struggling to get the Chrome back up. I don't understand why that's happening. Hmm. 1 second. Let's do other questions first. Um, I don't know what's happening. My computer is stalling. Just rarely happens. It's a new computer. It just wouldn't open my browser. Just shut it down. Um, okay. Right. But actually, interestingly, I have to bring the Chrome because I can't show you anything without it. So we'll have to do that. Okay. I apologize. This never happened to me before. I can't open the Chrome. It's blocking me. So I have to find, let's do this. Okay, I'm gonna have to do this manually, unfortunately. Okay. All right, so this is hopefully gonna work. Okay, of course. Um, okay, so I'm not able to do that. So let's do this. I'm gonna go to GWCIM. Okay, so let me show you a couple of things. So first of all, let me show, oh, by the way, the new website is up. We just updated our website for the clinic. So let me show you resources. Okay. Ah, new website. Partners and affiliations are not working. Okay. Right. Uh, Okay. So I cannot show you the vibration plate, but basically what will happen in the next day or two, we will have the vibration plate on our website. We always had it. There's a link. If you, my patient, by all means, shoot me an email. What I will do is I will send you a link to the vibration plate we recommend. It is under our affiliates and partners in our website right now because it's a new website. There's an issue. So let me see if I can. I'm struggling logging in here because this is not my preferred app, so I can't get in. So what I'm gonna do is I'm just not gonna do this. I'm just going to go to Google and I'm gonna show you a couple of products that I typically recommend. So first product is this one. So this is a lot of you probably own this product. It's by Integrative Therapeutics. So I'm gonna just pick probably their own website for consistency and show you that. So this is OsteoPrime Ultra. So that's the product. So let me show you ingredients that you fully understand why I'm recommending this. So if you look at the label, okay, you will see that there is a variety of different nutrients. So first of all, look at the form of calcium. So you have this is the borderline chelated. It's not exactly chelated, but it's closest you can get. So you see there are a variety of different organic forms. Carbonate, tribasic phosphate, lactate, and citrate. So this is probably a better form. Notice that this product also has lots of other minerals. It has phosphorus, it has silica, as I said. It has this. It has a little bit of strontium. The amount of strontium is minuscule. This is 6 milligram. Often, what I would recommend would be upwards of about 600 milligrams, but typically it's 300. And also, this has 45 micrograms of K2 in the MK7 form. It does have all the magnesium. Oh, this is better. It has magnesium. It has um, manganese. It has basically all other minerals, zinc, copper, etc. So this is a full bone multivitamin. It does not have a couple of specific nutrients, vitamin A and E. So if those are important for you, this would not be the preferred product. You would need to think of something else. But it has everything else. It has even all the B vitamins in a substantial amount. Thiamine, as you can see, it has everything. So that's one product I like. So let me show you other products. So somebody mentioned Perk product. I like that product a lot. I do recommend it routinely. Oh, this is not going well. Okay, so there's also a couple other products that I'm going to show you. So one is called BoneUp. So this is a more specific, just the mineral formula by Jarrow. I apologize. I'm just going to pick random websites. I don't know. I don't use this website. It's just for whatever reason, I can't get into the Fullscript from here. So if you look at this product, notice that there is really no other vitamins except for minerals. There's, a little bit of C, there's D, but there's really no B vitamins of any kind, right? There's no antioxidants. So this is a purely mineral formula. Okay. And this is in two tablets. So notice that there is 400 milligrams of calcium, so you would need to take two twice a day. And this is very similar with the OsteoPrime Ultra. You would also need to take two twice a day, most people. This does have a little bit of collagen, although this is a very small amount. This has more vitamin K2. So different applications. So this would be added if you already have a good antioxidant or B complex on top of that. So, and then I'm going to show you a couple other products. So one is Metagenics has a good product. I think it's called Bone Builder. I do like this one quite a lot. Recommend it often. So this would be, and there would be different bone builders. Like for example, there would be a bone builder with the magnesium. So I'm just going to show you this one. So this is an even simpler formula, but this has a bit more of this MCHC. So this is another ingredient that sometimes people add. It's a hydroxyapatite concentrate, which is Metagenics likes this quite a bit in all of their bone formulas. This is a 3 tablets per day will give you 620. A lot of people, this is sufficient. So for a lot of people, 620 milligrams of calcium would be enough. But you can take an extra tablet. So you can take two twice a day, and then you will get to 800 here. So if you want, this is again, this is a bit narrower formula. So if you're taking this, you'd still need to take other minerals, but this is a really good source of calcium if you'd want to take that. And then let me show you Perk as a last product. Perk product is I'm trying to remember exact name. I think it's remember the bone. Let's just go to back to Google and go Perk bone. So, okay, so Bone Guard, right? Okay, so this is the product. This is the last one I'm going to show you that I tend to use a lot. This is kind of a closer to the OsteoPrime Ultra. It has a bit of everything. It's not as broad, so there's no B vitamins here, but it has some antioxidants. And this is a complete formula. So notice it has all the minerals. So this would be kind of, they're all slightly different. So the OsteoPrime is the broadest, then goes Perk, then goes BoneUp, and the most specific, most narrow is the Bone Builder by Metagenics. So those are the common products I use. Now, that's not the only ones. There's lots of other products. If you were taking something similar to that, that would be perfectly fine. So I'm going to stop here. And oh, thank you, Stephanie, for the links. So you guys can take a look at all these links in a Fullscript. And again, I apologize. I don't know why I'm having these problems today. Quite unusual. So probably things will come back to life the moment I finish the Zoom, as it always happens here. So expiration dates, interesting. Yeah, expiration dates are important for liquid products. Aloe vera should be thrown out if it's expired for sure, because any liquid products that expired, they're probably true expirations. For non-liquid forms, it's probably okay. Um, Particularly if there's no antioxidants. So like minerals, for example, it probably doesn't matter. I mean, they can probably, just like medications, they can be used way past expiration dates. New chapter, yeah, new chapter bone supplements would be good. Again, I'm not really negating that. The reason I'm using this is just because this is what I like to use. It's not particularly, it's just what I've over the years became comfortable with using. There's tons of great products. There's tons of great brands. Yes, so if you found a product like New Chapter is a very good brand. If you found a brand that uses more organic form of calcium, by all means, go for it. So RS, I think would be a good product because again, it looks like they're deriving that calcium from algae, which would be in a natural organic chelated form, just like the integrative therapeutics. Yeah, so just be careful, Kathy. There are different types of bone ups. So there's a bone up ultra, there's like bone up 3 a day. So you have to be really careful with exact. That's why I like the bone up series because there's lots of different choices. So I think you need to find specifics to make sure it's an appropriate product and you're not taking too much. Yeah, correct, Janine. So, vibration plates have other benefits, and vibration generally is very healthy for the body. So let's actually transition to the second part, to the a little bit of a mindfulness practice. We're going to do a little bit of a movement. And while I'm doing this, I'm going to walk you through the way I think about vibration in general and also what exercises can be done for the bones. So you guys can get up. That would be probably the best. Make sure you have a space around you because we're going to be shaking. Now, we've done this practice before. We've done the shaking Qigong where we do this, where the whole body shakes. Now, couple of things. First of all, you will never get to the adequate frequency of shaking. So don't try to get to 40 hertz. Don't even try to get to 5 hertz. It's not possible. You're not going to be able to shake the machine the way a machine shakes you because it's impossible. I mean, our muscles cannot shake that fast, simply. But why is this valuable? Because in addition to when we passively being shaken, vibrated, here we're using our muscles. The whole body is moving. So that is why the whole system becomes integrated in the sense that you making your muscles do the shaking for you. So that's the shaking Qigong. So now, what else can we do as part of this repetitive bouncing effect? Well, obviously, trampolines. Trampolines are amazing. They're very good exercise. If you ever stand on a big one, like my kids had trampoline at old house and at the cabin for their basically entire life. And when they were little, they were on it all the time. Why is it so useful? Well, because on trampoline, you have to constantly engage the whole body, not just the muscles, but also orientation and proprioception. So it allows you to build sense of balance in addition to just the bouncing. Bouncing seems to be critical for bones. So any sports where you bounce all the time, whether it's a skiing of any kind, horse riding, even biking to some degree, right? Not the road biking, but the mountain biking. You're going to be bouncing. So the any kind of bouncing movement would be very, very good for the bones. Obviously, skiing, mountain biking, there's risks involved, right? So those are riskier sports compared to this. So if you like this movement and you're not going to invest hundreds of dollars into the vibration plate, do this. So you basically start slowly. I like to start with just vibrating my hands first and the shoulders so that the body loosens up a little. And then you begin to add the whole body. It's important that everything moves. You don't have to do it violently, right? This can be very comfortable, very relaxed. If you start engaging whole body and doing something really crazy, it's okay, but you don't have to. It's the goal here is actually not only allow your muscles to shake, but also release the central nervous system. So this practice has more than one application. And you can also change position, you can rotate, just experiment, just flow around with the different states where you almost like following your body natural rhythm of shaking. Let everything float rather than make it very forceful. And you can experiment with higher frequency if you want. If my voice sounds funny, that's the point, right? Because I am vibrating after all, so the voice is going to follow that too. And you don't have to do this for long. This is actually kind of tiring. Like if you notice, if you're doing this relatively intensely, you're going to start tiring out. And that's good. I mean, it means that an exercise is working. Try to shift the weight a little bit between the legs. Don't forget to move neck, upper back. Try different positions. Make sure nothing is hurting. That's important. You can harm yourself with this if you overdo it. If you start really tiring out, begin to slow down. In fact, we're just going to do this for another minute, and then I'm going to start slowing down. You can overdo this and then get really exhausted. This is not a light exercise. If you do this a little faster than slow. Okay, let's slowly begin to wind down. Just kind of gradually come to standing. Take a couple of breaths here. Check in with the body before we sit down. Okay. Okay, now grab a chair and come back to seated. And now we're going to do a little bit of a breathing. But what I want you to do is, after you came back to the chair, close your eyes and let's tune into how you're feeling. See if you can pick up on anything that's discomfortable. If you have any part of the structure that's telling you that this was not easy for it, just give that attention. Okay. Okay, so let's do the last part of the exercise, which is I'm just gonna center on a breath. Begin to slow the breath down. Inhale and exhale through the nose. Check in with your body to make sure that everything is as relaxed as it can be. If you need to reposition your body, if you need to lay down, whatever you need to do to get more comfortable. We'll do a couple more breaths here just to continue staying in a relaxed state. Okay. So let's slowly come back. We still have a few minutes, and there are a couple other things that I want to talk about. Um, so if you're going to choose to do the vibration of any kind, right? So notice we did the practice for probably about 5 minutes. People who don't do this routinely, doing a lot more than that, it's actually hard. I don't know if anybody noticed that you started to feel a little bit tired, right? Towards the end of it. So that's good. So imagine if you're using the vibration plate and there's a passive movement, you're gonna feel it's easier to do because you don't have to engage the muscles. But actually, if you're doing it at high frequency, first couple of times you're gonna do this, you're gonna feel this weird too, because the body is not used to this vibratory impact. But you get used to it very quickly. So if you choose to do this, you don't have to go above 20 minutes of any kind of vibration. The typical recommendation is sits at around 20 minutes. I've had a lot of my patients use the smaller plates just when they're working for a couple of minutes, maybe 4 or 5 times per day. So you literally just put the plate under the table and put your feet on it, and you're working as you're working in the office. And it's not a full benefit, but it's a partial benefit, and it's very easy to do because you can do it throughout the day a few times. It's a very good break from routine sitting. It's also, this practice is wonderful to do in between different things. You're on the bus for a long time, on a train, you just need to wake the body up and get this in. Okay, just stand there and vibrate for, 2, 3 minutes. In between, you've been sitting for an hour, get up and do this. So this is a very good practice. It's basically a traditional qigong. Now, we've done traditional Qigong in a more appropriate form. What we did today was very random, right? So this is not a specific Qigong-based practice, it's just the vibration. So total time would be 20 minutes a day, Patricia. You can break it up in any shape you want. You can break it up in 4 sessions of 5 minutes, or you can just do one session of 20 minutes. You will have a really hard time doing this for 20 minutes, trust me. It'll be pretty tiring. I'm not saying don't do it. I'm just saying just might be mindful of that. Of course, if you're doing a lot of walking and running, it's a bouncing too, right? Why is this bouncing different? Frequency. Frequency matters. What we did is a way higher frequency than walking or running. You would need to run at a very fast pace to get anywhere near this, and most of us will not be able to get there. So exactly. So it does feel like Zumba class because Zumba can be quite intense, right? Now, again, it's all of this is a little different. This is only an option. You don't have to do this. If you have a severe osteoporosis, any physical activity with the weight bearing would be good. Why Tai Chi and Qigong have been shown to be better for bones, nobody fully understands. We don't know. We don't know why slow-paced Tai Chi, Qigong, and Qigong shaking seems to be better than yoga, weight-bearing exercises, even many specialized classes that are designed for bone strength. There's a little bit of mystery. There has to be some energetic component that kicks in here. We don't know what it is exactly. So, but generally that difference is small. So any exercise, any weight-bearing exercise be good. Zumba is amazing. Zumba has all kinds of other benefits. It's a very good cardiovascular exercise as well. Okay, so with that, we can do a couple more questions. Any final thoughts anybody have? By all means, go ahead and share. And yeah, no citric. Oh, citrical. Yeah, I'm not a big fan of inorganic forms of calcium. I like organic forms. There's nothing particularly wrong with citrical. If that's the one you've been taking for a long time, just make sure you don't take more than 600 milligrams in one sitting. Take 400 or 500 milligrams twice a day. That would be fine. Um, and a lot of people prefer to take calcium separately. I don't have a problem with that. It's just I feel like often people taking so many supplements as is that adding individual ingredients just gets more and more sophisticated. You end up with more and more tablets, more and more capsules. I often like to combine them to minimize the number of bottles you have to use, even if the total number of pills will be the same, but at least you'll have less bottles. Sooner or later, I will probably ask our new partner, the Vitamin Lab, come and talk to you guys. So we have a company that is now compounding special supplements just for our patients. So this is basically we create an individualized formula for every patient. Believe it or not, it ends up saving money for people who take a lot of products. So if you take more than 5 products at the same time, you actually can save a lot of money on this because some of the products are quite expensive. If you're only taking a couple, it doesn't make sense because this company starts to make a lot of sense only when you take a lot of different products. So then they can be reorganized into a more specific formula just for you. Okay, so with that, the formal part is over. Um, Yeah, so again, you guys, I apologize right now. We have a problem because I need to get into my email to get you links. So if you want to have this company, I suggest you just email me and then I will send you the information because it's just today is this weird glitch. I'm not at home and I'm struggling with the access to our website change. So it's just hard for me to get that exact link to you today. It's just literally a company called Vibration Plate. Actually, I'll tell you exactly the name of the company. But there's also a discount code that I negotiated with them. That's why I am. So it's called Vibration Therapeutics. That's the name of the company, vibrationtherapeutic.com. And the discount code is GWCIM. So let me see if I can just get this. Okay, so this is the link, and the discount code is GWC. They have a couple of different models. They have, make sure you get the model that is higher frequency so that it's at least 25 hertz. And you can choose the one that has the holders and one that doesn't. They are a small company. They're very competitively priced. High grade plates are gonna be expensive. You will not find a high grade plate for less than $1,000. They'll probably be about $1,500. This company is a little cheaper. They're very good, but they're a little bit cheaper. So they're all of their products are under 1,000. So don't buy any vibration plates that cost $100 or $200. It's all garbage. The reason is the motor that has to vibrate at that high frequency has to be very strong because otherwise they break just within a few months. So that's why a lot of the products that are on Amazon that you're going to find, they're going to be, even if they say high frequency, when you start actually reading what's in there, you're going to be quite surprised. It's not the same because the motors are quite complicated. You also, a couple other funny points. First of all, if you don't live on a ground floor and you have people under you, you get this high frequency vibration rate. You better get a thick mat because they will call police on you. I'm not kidding. The whole building is going to start vibrating if you live in an apartment building. They're going to start saying, I don't know what they're doing. They're killing somebody upstairs. So, if you have multiple floors in a house, if you have a gym in the basement, that's great. If you put it on top, remember there's going to be the whole house will feel the vibration because that's how powerful those motors are. And that's what you want for the bones you want that. When we turn on now our clinic, it's a cement building, so we don't have as much. But if you have a standard construction, the wood, it's gonna it's gonna be quite a noise. So getting the thick rubber mat to put on there is a great idea. It's gonna muffle the sound quite a bit, just gonna have your neighbors below happier. I've had that situation with one of my patients. It was a really funny conversation. The neighbors were complaining. Um, okay. Well, thank you, everybody. This was good to have you. Stephanie, thanks so much for telling us. So next week, we're going to have our Julie Wendt and Yael Flasbeck. So these are people we know really, really well. I'll still be there with you, although